Good afternoon and welcome to Bermuda's News and Views. I'm your host, Don Burgess, and I'm very privileged today to have the Health Minister, Kim Wilson, with us. Welcome.
Thank you.
So last week when I was thinking about what to do for a show, I had reached out to the DCI about this early Friday morning, and then you had your big press conference, so this is good timing for us. I know you gave reasons for looking for change in Bermuda's healthcare system at your press conference on Friday, but can you sort of summarize why government is looking at making some changes? This is not a proposal set in stone, but like you have on other policies, you're seeking consultation and asking for feedback.
Right. Well, first of all, thank you for inviting me here to provide some more background information and some particular details to a very important issue that affects each and every one of us. Obviously, our health is incredibly important to us all, and the government wants to ensure that we do what we can to make Bermuda healthier. And you would have known from recent conversations that we've had that unfortunately we have some very, very sobering statistics as it relates to the level of unhealthiness that we have within our population. Over 3/4 of our adult population are either overweight or obese. Approximately 54% of our population have adult population have at least two risk factors for chronic diseases. So we have a very sedentary lifestyle, as well as our diet and so forth, all help to contribute to, unfortunately, a perfect storm. So we as a government want to take steps to make sure that we try to assist people in becoming healthier. We have currently a standard health benefit that 95% of that benefit effectively goes to inpatient and outpatient services at the hospital. Some diagnostic community services are also provided, but very little prevention. And what we need to do is to ensure that we offer a benefit package that allows people to get healthier and stay healthier by adding more elements of preventative care and prevention. The World Health Organization has indicated there are certain essential benefits that should be contained in a health benefit policy, and that includes preventative care and prevention. So what we're looking at is a plan that allows for more doctor's visits that have a controlled copay element. We know that one of the complaints that we've heard from many members of the public is that they don't go to the doctor as often as they would like to because it's an exorbitant copay. If they don't have the opportunity to go to the doctor, then there's issues concerning whether or not their illness could have been preventable had they had sought earlier treatment. So we're looking at ensuring that we have more prevention in our policy. We're looking at also including things like vision and dental as well. So in addition to wanting to keep Bermudians healthy, we need to also develop a benefit package that allows for more preventative care. How do you pay for that? Well, that's what we're looking at, and that's where the unified system has been adopted by the government, the model, to help to pay for that particular benefit package that I'm speaking about. You might recall several months ago there was quite a lot of discussion insofar as whether or not we as a government advance towards a unified or a dual system with respect to paying for our health care. And the government has decided, which was announced last week, that we will be doing a unified model, which effectively means that all of the population of Bermuda there will be pooled into one system where the offering of the standard benefit, which is now going to perhaps be referred to as the Bermuda Health Plan, and that all persons in the community will be able to purchase that particular plan from that pooled, unified pool.
Yeah, as opposed to where you go to an employer and the employer buys it from BF&M or Colonial or whoever else it may be.
And that's a good analogy. Effectively, what we'll have is there'll be one provider of that benefit package, right? Whether or not there will still be an element of employees involvement, or we've got individuals that are perhaps taxi drivers or sole practitioners that have their own type of business entity. That's part of the consultation. So when we announced that we would be going to a unified system last week, we also announced that we would start a public consultation period, a 4-month consultation period, which involves members of the public, IB, the non-for-profit sector, churches, unions, everyone. We want them to help to participate in 2 particular areas. One is as it relates to the benefit packages itself. We've produced a mock benefit package that includes things like vision, dental, overseas treatment, medication, and the like. And we're inviting members of the public to look at that mock plan and see whether or not it suits their needs and whether or not they would like to see a different type of benefit, i.e. orthodontic benefit or less vision. That's part of the consultation process, which is really, really critical. And we're inviting everyone to participate in this because this is going to be the Bermuda Health Plan, so we all need to be able to be party to that. As I said, the consultation period will be for 4 months for the public consultation. However, it will continue for many of the stakeholders, the healthcare providers, the insurance companies, and the like, because they have to be part of that process. So the first part of the consultation will involve the benefits package that I spoke about. The second part is the roadmap. We are actually transitioning our system from the current system insofar as a fee-for-service payment system to a unified. So how do we get there? So that roadmap has to be established insofar as what does it look like, what are the timing, what are the mechanisms that will be involved to get us to a unified system. So in order to do that, we need to have all the players at the table as well during a consultation period to help to establish what that roadmap would look like.
And if people want to weigh in or they have questions, where should they go
They can go, yes, to the government website. If you go to the government website under the Ministry of Health, there's an abundance of information. The consultation documents will also be published at the government website as well as on the Bermuda Health Council's website as well.
If they want to look at the health plan, it's www.gov.bm/health plan.
That's correct.
Here.
If that's what you say, but yes, that's correct.
The preventive medicine. You've talked a little bit about trying to get people to be healthier. Why do you think this has been lacking in the past?
Well, when they first edition, when the standard, it used to be called the standard hospital benefit, and then it was changed a couple of years ago to say the standard health benefit, was first introduced. It was to ensure that persons, and this is like in the 70s, it was to ensure that persons had a minimal package of health insurance so that in the event that they had to be hospitalized or receive hospital treatment, either inpatient or outpatient, that they had coverage for it. So under the law, every insurance package that's offered and sold in Bermuda must contain in that package the standard health benefit. Again, it was introduced principally at a time when they wanted to make sure that if you were going to be hospitalized, you would be able to have that service and it would be covered under your health benefit. We've moved on from that, and I think a lot of people are recognizing, and health practitioners and the like, that it's critically important to concentrate your efforts on prevention. They say prevention is cheaper than a cure, and we need to make sure that we have sufficient benefits in our package that allow people to either prevent an illness from not improving, from increasing or removing their quality of life, or alternatively help to arrest the illness or slow down the illness by having that preventative measure, having that ability to go to the physician if you're unwell, as opposed to waiting until months and months and months, and then you end up in hospital for a disease or for an illness that could have been prevented had you had that opportunity to seek a doctor first.
You talked about it sort of being a single payer system. How will that help people who maybe are a little bit unhealthier and have difficulty finding jobs because if they go into a small pool, they raise the health premiums of everybody in that one job situation, whereas being in a larger pool of Bermuda now, that hopefully that'll make them more employable as well?
Not so much more employable, but you just answered the question. Previously, heretofore, we had several pockets of small pools. So, for example, if you were employed with a company and there were 3 of you in that group, that pool, and one of your 3 persons had an illness, they perhaps got a cancer and they required treatment either overseas or locally, then the other 2 persons' premiums would likely increase because there's more utilization, there's more costs that have been attributed to that pool of 3 individuals. On the other hand, if you have a pool of 65,000 people, so all of the population are pooled in one particular pool, if that same individual has a cancer and has to receive treatment, it's shared amongst the other 6,499 persons. So you're spreading the risk, so to speak, as opposed to having it all concentrated in a small pool where the risk is obviously going to be intensified when it's 1 person versus 3. 1 out of 3, excuse me, where you've got 65,000
Right.
people sharing the pool. So it's spreading the risk around, which will make it more cost effective and reduce the fluctuations that you see with some of the premiums and the like, because it's all unified. All of the people will be provided for by one provider in a unified pool.
I think like the last time I had an interview with you, I talked about somebody I knew who was working at a small company of 10 people, but was constantly going to Leahy, and the insurance premiums for the rest of the employees kept going higher and higher
Yes.
until the point where like the employer was losing other employees because they didn't want to pay the higher premium working for them.
Right, right. Well, this particular model that we're speaking about will help to eliminate things like that, because all of the persons will be pooled together for the Bermuda Health Plan, for the basic package. And this basic package will obviously, based on the consultation, be more enhanced than what exists now under the SPR. Remember I said the SPR has the standard premium, the standard health benefit has very, very little prevention. So it will help to minimize those type of episodes. Now, some people say, well, is this all that there is? Well, if there is an individual or a company that wants to have more coverage, perhaps major medical, there will always be a need for the insurance companies to continue the provision of supplemental insurance benefits.
Right, so it's not limited to whatever the basic plan is, just like it is now.
Correct, correct. So this basic plan effectively that we're speaking about that's gone out for consultation, the mock plan that's on the website that you just quoted, that particular plan is what we're consulting on, and we're asking persons to provide their input as to whether or not those are the type of benefits that they would like to see. That plan will replace the existing standard health benefit plan. So it's a superior plan, and again, if individuals will be that they'll be able to obtain that plan, and if they wish to add on to it and receive supplemental benefits such as an executive physical once a year in New York City or whatever the other executive benefits that they like to see, or supplemental benefits, and they will then be able to negotiate with the insurance companies, the private insurance companies, who offer and who will continue to offer a supplemental benefit package.
But I think like a major portion, at least the way it came across to me, and you mentioned it, was there are a lot of people who were at the bottom stratosphere in Bermuda as being able to afford health care. And you mentioned, GoFundMe pages and things. And recently we had the young 13-year-old girl, Unaya Bell, have to go. She had a brain hemorrhage and had to fly her out right away. And they set up a GoFundMe page. So you're looking to help address these sort of situations.
Absolutely, Don. Unfortunately, we have about 8% of our population that are either underinsured or uninsured. And this particular plan that we're going to roll out under the unified system will be able to help those individuals. The young lady that you just spoke about, unfortunately, there's a number of us that we see in the newspaper or read on social media of individuals starting to have GoFundMe pages to pay for their overseas treatment, or alternatively bake sales, or and what we're looking at and what we're anticipating will be the case is that this particular plan will be able to include overseas care for medically necessary treatment that's not available in Bermuda.
Right. So when you say medically necessary, so like in this case, it's obvious medically necessary.
Correct.
It's not going to fund people wanting to go get liposuction or plastic surgery or something like of that nature.
Or augmentations of their body. Yes, that's exactly right. It has to be something that's medically necessary and that is not available here in Bermuda. You're absolutely right.
Is that covered under HIP now anyway?
Under HIP, it is covered under HIP, and it's a percentage.
60%, I think, or 50%.
No, I think it's a little bit higher, but
higher.
It is a percentage, so there is an existing copay. Depending on whether or not you're in network or out of network. However, the point being that what we're looking at with respect to this new plan is that provided that it's medically necessary and unavailable in Bermuda, then it will be covered. And to what extent a copay may or may not exist is part of the consultation process.
So I won't be able to go and instead of going to the gym and work out, I can't go overseas and get fake muscles put into my biceps and things.
No.
Unless I pay for it myself.
Unless you pay for it yourself, exactly. Nice try.
What will happen to people on future care?
The plan, like I said, so this Bermuda Health Plan will effectively replace the existing standard health benefit, right? So for example, whatever benefits are included, so under the standard health benefit, medication is not included. However, this particular plan is envisioning a $400 medication benefit. So the persons that are on Future Care will already have the benefits that they get. Plus, because remember I said the standard health benefit, which will be replaced by this, has to be included in every policy. So whatever benefits or whatever enhancements exist for the Bermuda Health Plan that we're modeling and speaking about will automatically transfer to Future Care patients. So they will see more enhanced benefits because the package that's required in law to be included in every health insurance policy will be enhanced.
Right. So the same for GEHI.
GEHI is a little bit different. Obviously, yes, because the benefit will be the same. I mean, the
basic.
The basic will change. But GEHI will continue to operate because it is a little bit of a different structure. And again, we'll be talking about that through the consultation, but it is envisioned that GEHI will continue operating as is. Future Care will continue to operate as is with the benefit packages that I've just spoken about will be transferred to both. And then HIP, because this benefit package will no doubt be superior to HIP, will be replaced by this particular package, the Bermuda Health Plan package.
So somewhere along the roadmap, HIP will be phased out.
Yes.
So people will, Dennis, if you can bring up the graphic. No, you don't have a graphic? Okay, all right. So everyone will get the standard health benefit, and then somewhere along the process, HIP will be changed into what this program, whatever it's going to be end up being called.
Right. So the Bermuda Health Plan effectively replaces the standard health benefit, right? So the standard health benefit goes away and it's replaced by the Bermuda Health Plan. That particular benefit package, whatever is agreed upon following the consultation, has to be part of an insurance premium, an insurance package. So because we know that it is envisioned that it will be better than HIP, then those enhancements will also go to Future Care and the GEHI because they have to be included.
Right. So I'm just, the audience can't see this, but I've got it in front of me. So for example, like on HIP, it says specialist care, max 5 visits, and then currently under the draft plan, it says specialist care visits, 2 visits. So it seems less
of a benefit?
Yes.
The difference, the principal difference between the HIP, which as you've indicated says maximum of 5 visits, and specialist care for the draft Bermuda Health Plan saying 2, is this. If you go to your doctor tomorrow and you have a specialist treatment, there is no regulation of your copay. If I go to the same doctor tomorrow and I have similar treatment, there's no regulation of the copay. What is envisioned under the Bermuda Health Plan is that all services that are provided under that plan will be regulated. So for example, the co-payments that people do find very challenging and very difficult to pay will be a regulated fee. Again, and that's part of the consultation so far as what does that fee look like. We've been meeting with doctors as recently as last week, but certainly over the last several weeks to help to continue that dialogue as to what will this plan look like, what will the fees be, because we want to make sure that we are able to come up with a fee that is beneficial to the consumer, but likewise to ensure that healthcare providers continue to operate. So that's part of the consultation process that we're inviting the members of the public to participate in.
So the copay fee will end up being less, and will there be a cap on it as well?
Absolutely, absolutely, there will be a cap on it.
Is $400 or what
No,
is
the
it?
$400 figure that we've modeled in the mock plan relates specifically to medication. Right now under HIP, there is no medication benefit. So that's an enhancement to the plan. Remember I was speaking about enhancements. That's one example of an enhancement. Likewise, with respect to the plan for specialist visits, as you just raised, there will be a cap on the co-payment. Likewise, if you have a doctor's visit and or vision or dental, there will be caps on the particular copay for those particular services. So all of the provisions of services that are offered under the Bermuda Health Plan will be regulated. The fees will be regulated. So the caps will exist for the copay portion for the consumer.
Well, I'm on HIP, so I know like I have to get a medicine once a month. So to me, that'll end up being a benefit for the end of the year.
Absolutely, and that's a good point because what I think, and perhaps, this is still new, so I'm hoping and inviting everyone to go to that website that you just spoke about.
www.gov.bm/health plan.
Exactly.
One word.
Exactly, so that people can see what the mock plan looks like, and they can make the comparisons and then provide their input. Because, as you said, with respect to medication, for HIP doesn't include medication, and we hear from a lot of persons that are on HIP, and they would like to be able to have medication. But for the mock plan that we're costed out, which is like $541, what people have to realize is that's the plan itself, right? When you speak about your healthcare costs, it also includes things like how much are you paying for copay, how much are you paying for medication, and there's those other out-of-pocket costs. So when you measure the plan and what is to be included in it, i.e. the ceilings of the copays, the medications and the like, the consumer in the long run will find a savings. Because you have to, when you talk about your healthcare costs, you just rightly said, it's not just what you pay for HIP every month at $419. You're paying medication, you're paying other expenses. So the consumer in the long run will find a savings.
Right. So you said in the long run, so how much more is this going to cost a month up front?
Well, the mock...
Or proposed.
Sure.
Proposed,
Okay,
proposed.
so for example, the mock plans that again are on the website, if you look at, for example, an adult, a single adult that has no children, no children or spouse, on average, if they were on HIP, they would be paying, and this is including all the benefits I spoke about, medication, the restricted copays, et cetera, they would be paying $7,058 today, and then on the mock plan, it would be $6,308. So they would see a savings of $750 over the year. That's just for a family, one individual. When you look at the website, we've done it for a parent with a child, a family of four. For example, a family of four, we would see a savings approximately of $8,468 a year.
Right. And there's lots of documents on the website for you to look at. I want to say probably about 10 or 12, but somewhere in that range for you to take a look at.
Yeah.
So it's really good to be informed to
Absolutely.
make a good decision on what you like and what you don't like.
Exactly.
In this plan, it also talks about basic vision, so which people don't have with HIP at the moment.
That's correct.
So why was this included? Why did you feel like this was necessarily?
Absolutely. Remember, we started by speaking about prevention, right? And you and I are wearing glasses, so obviously we have to pay for vision care at least once a year, once every 2 years, however often the doctor requires it. And the plans, when we look at what some of the benefits are and what was being proposed that are essential benefits under the World Health Organization, as well as the Health Council have been very actively engaging members of the public to say, what type of preventative care would you like? And we're seeing individuals say things like dental and vision. These are all measures of preventative care. So currently, the standard health benefit provides very little preventative care. 95% approximately goes to hospital inpatient and outpatient procedures, and then a small part is for things like mammogram or other diagnostic imaging that's conducted. No preventative care. We want to change that and change the paradigm so that people recognize that it's important to stay healthy. The government's objective is for people to get healthier and to remain healthy. And in order to do that, we need to ensure that we have enough prevention in our packages and preventative care so that persons are able to, live healthier, longer lives. We know that when people are sick and their life, it impacts adversely on their employment, and the employers suffer because people are calling in sick. Their quality of life is obviously diminished. Their family life, there's just a number of nobody wants to live unhealthy. And if we can change the package so that we can add more preventative care, such as vision care, then it makes a healthier community, and that's our objective.
Yeah. Unfortunately, it's a sad part of life as we get older. Even if we didn't need glasses when we were younger, we do as we get older.
Yeah.
So are you looking at a checkup every 2 years? You can get for vision care? Is that and a pair of glasses? That might be a little bit too much nitty gritty.
No. I think again, and that's part of our conversation and the consultation. I think what was modeled was vision care twice a year, or no, dental, 2 hygienist visits, and then vision care on an annual basis. But again, that's part of what we're modeling and what the discussion will, the consultation process will, it'll be formed based on the consultation process.
When you were sitting there developing this obviously you reached out to a wide variety of stakeholders. Who was involved in bringing this to this point?
With respect to the benefits package?
With the benefits package?
Right, okay, the benefits package, like I said, the Health Council have been conducting surveys and public town hall meetings and so forth for a number of years, asking members of the public, what would you like to see in your benefits package? And that's where we've heard people say, well, I'd like to get vision, or I'd like to go to the hygienist once a year, et cetera. So that was part of the conversation, and that framed part of the benefit package that's costed out for the mock plan that we've spoken about. In addition to that, the World Health Organization has said that there are certain essential preventative benefits that should be contained in every single person's benefit package, right? Healthcare is a universal human right. So therefore, when you look at the information that the Health Council has been able to gather from members of the public like you and I, coupled with what the World Health Organization is saying needs to be included in a package, the essential preventative measures, that's all that information together helped to form the mock plan, which is going out for consultation. And we want to hear from the public to say, do you think that that's sufficient? Do you think we need more, or do we need less? And that will help to form what will be contained in the benefit package, as well as the costing element of what the cost for that particular package and what the community feel would be something that they'd be prepared to pay. That's all part of this consultation.
Just to be clear, everyone can still go see the regular GP. They don't have to make any changes. They can stay on the whatever health insurance company they're with. But none of that.
No,
changes.
that's a very good question, and thank you for asking that. No, the status quo as is. What we have announced of the last week is that moving forward, Bermuda will transition to a unified system. There'll be one provider of the basic package, the health plan, the standard health benefit, which, like I said, will be replaced by the Bermuda health plan. So there'll be the one provider versus several providers. So that's the unified. And then secondly, following the consultation, we will have a better idea of what the benefit package will look like, a cost point that the consumers are prepared to pay, et cetera. What we're looking to do, because this is transformational, and we know that this is going to take some time, and part of that important consultation process is the development of that roadmap, where we'll have all the stakeholders at the table. We're looking at a soft launch of the fall of 2020, but we know it's going to take us several years for this to completely be rolled out, because it has to involve everyone, and every person, all 65,000 people, will have to be registered for this type of plan. So that's part of the process. When we start with the soft launch in the fall of 2020, what are we starting with? That's part of the roadmap. That's why it's so incredibly important for everybody to come to the table. Because we know we can't do this overnight, but there may be areas where the consultation process reveals this is the area you should start at. So all that has been identified now is that the way that we're going to pay for this basic package that's going to include far more preventative care is a unified pooling.
Where does government look to, because if it's going to cost the consumer less and get better health, where is government going to be able to realize some financial savings through this?
Well, that's a very good question as well. The policy itself, because of the way that we're structuring it, we're going to be able to have more fiscal space within our healthcare system. Right now, we pay over $770 million on healthcare. So for a population of 65,000, that's over $11,300 per person. That's ridiculous. And we have horrible health outcomes. So, it's just a disconnect between how much money we're paying and then we've got these poor health outcomes. So we'll be able to have fiscal space to look at other things like whether there should be concessions for people that have healthy lifestyles, and if you can measure that they're improving in their health outcomes, such as their cholesterol is they're going to better figures and so forth. Those are things that we'll be able to look at. Yep. We're also looking at the regulation of prescription drugs. Obviously, pharmaceuticals, the concern of medication and pharmaceutical prices is something that we hear quite often, and we're developing a formulary. So some of the most highly used drugs in Bermuda, perhaps for blood pressure, et cetera, that formulary is going to be developed, and that will be regulating the cost for those particular drugs.
Insulin, for example, might be
if that's one of, yes. We're, like I said, we're looking at more chronic disease management. Again, we've got, unfortunately, some crippling numbers as it relates to chronic diseases, and we need to put more money into prevention to help to manage that, so that people have somebody to assist them managing their chronic diseases, so that it doesn't escalate to such an extent where they end up in hospital. And we know it's far more expensive to be in a hospital than to go to a doctor and have the doctor help manage your chronic diseases.
Well, I know you lead by example as far as trying to have a healthy lifestyle, 6 a.m. in the gym.
Yeah.
If more
You said you were going to join me.
I don't think I ever said I was going to join you.
You said you'd consider.
I'd consider it. Unless Dennis wants to take my spot at 6 a.m. He's laughing at me.
CrossFit Bermuda, come join me.
So a half hour's gone by already, very quickly.
Okay.
But is there anything that you want to leave the rest of Bermuda with? Again, www.gov.bm/health-plan. Anything you want to say to them?
I think that this is such an incredibly transformational, important task that we are undertaking right now. And that because healthcare touches each and every one of us, it's so incredibly important. I'm really encouraging members of the public to participate in the consultation process. We need to hear from you. We need to hear what type of benefits you would like. We need the parties to participate in so far as how we're going to get there with respect to the roadmap. Consultation is incredibly important. We've announced that we're going to do a unified pool. However, insofar as the other processes, insofar as the benefit package and the roadmap, that's where the public has to play a vital role. And because, again, it impacts us all. The government is committed to doing what we can. We were elected to address and arrest the rising cost of healthcare, and we believe that this is certainly one of the things that will help us to do that. However, we can't do it alone, and we need the public to help participate, particularly as it relates to consultation.
Well, the health minister wants you.
Thank you.
All right, Minister, I'm very happy to have you as always on the show.
Thank you very much for inviting me.
I appreciate the information that you've shared with the audience.
Thank you.
And we'll be happy to have you back maybe in 4 months' time when the consultation period ends.
That would be great. Thank you.
Just to see what some of the results are.
Okay.
All right.
Excellent.
All right. So, this is one thing that affects all of us. Everyone has insurance, or, well, not everyone, but most of us have insurance, and the rest of us, if you don't have it, wish that you did. So please take part in the government survey and consultation. Give your input so that they can have the widest cross-section as possible. I'm your host here for News and Views, Don Burgess, and as always, I want you to have a beautiful rest of your day.